When we talk about natural pain relief to use during childbirth, there is one thing that you have to remember. There is no pain relief that is more powerful than having a birth support with you during labor and birth. A person that you trust and that you know. Wouldn't it be great then if this person also is aware and knows how to do some tricks and techniques to help you better cope with labor? Let's start. Welcome to my channel. If you're new here and this is the first video you watch, my name is Ilenia. I am a midwife with a passion for education and empowerment during your pregnancy, birth and postpartum journey. Today we talk about one of those things that I want you to put into your labor toolbox and take it out when that time comes for you. I'm talking about touching and massaging during labor and birth, and this should be done by your midwife or by your birth support. Whoever you've chosen to be with you for your birth, your husband, your wife, your boyfriend, your sister, your mom, your friend, I really want to make sure that you have someone to do this incredible journey with you. Women that have a labor companion have been shown by evidence and studies to have better outcomes and also to be much more satisfied with their birth process in general and regardless to the birth outcomes. So something to keep absolutely in mind. Please make sure that you choose an eligible person, someone that you trust, that you know, that is able to support you and be active with you during labor. Being touched and massaged during labor is a lot of benefits, and we have so many evidence that support this theory that says that being touched and massaged during labor really reduces the feeling of pain that a woman might experience, also promotes the release of the natural painkillers that your body produces, like hormones such as endorphins or oxytocin, reduces muscle tensions, for example, promotes blood flow by being touched, and let's be honest, everyone likes it. Also, like in general, not just in labor, but in labor you want to be sure that whoever is supporting you knows what you like the most, and the secret for that is actually to practice also before labor comes. And remember that in labor you might hate something that you previously loved, or your perception of what you like and don't like might change during labor according to what phase of labor you are in. It can also speed up the process of labor itself, believe it or not, because if you associate the discomfort of the contraction with a pleasure, with a feeling that you like and you enjoy, you're definitely looking more forward to have another contraction, because you know that with the discomfort of the contractions, you're also gonna have a pain relief technique that is gonna help you to cope through. So it really promotes also in a way your flow of contractions. Sometimes gentle touch and massage is not enough in labor. In labor you want to have like a firmer touch, or even use touching and massaging for between the contractions, like gentle touch or a forage or pouring hot water on the abdomen or on the back really helps to get through labor. But sometimes you might like something a bit stronger, and this is usually achieved by doing something that is called counter pressure. Why do women like counter pressure? We're not 100% sure yet, and there might be more than one answer correct. But one of the theory is the gate control theory, that stands on the basis that pain travels through the nerves of our body to our brain and delivers the painful sensation. But by kind of distracting the pain sensation, then you can reduce the perception of the pain. And by distracting, I mean alterating or deviating the pain feeling transmitted by the nerves, and you can do so by doing counter pressure. In general, in life, the pleasure sensation travel much faster to our brain than pain does, because our bodies always try to escape pain. So on this basis, counter pressure can be very beneficial in that sense, but it can also help the progress of labor itself, and I'm gonna show you why when I explain you the techniques. The first technique I'm going to show you today is called the sacral pressures. Now, as the word says, it really consists of doing a firm pressure on the sacrum. Doing counter pressure is pretty easy once you know a bit of the anatomy of the pelvis and know what you're doing. So the sacrum is this bone here at the bottom of your spine, and it terminates with the coccyx, that is the bones that we use to sit mainly. So by putting the palm of your hand of birth support, I'm talking to birth support now, putting the palm of their hand on the sacrum and pushing towards internally really helps to relieve the discomfort that you might feel, especially in early labor or at the first part of labor. This is because also by encouraging the sacrum to go internally, you open the inlet of the pelvis wider, and this helps a baby that is high in the pelvis to engage a bit better if you widen the top part of the pelvis, that you can achieve by doing sacral pressure. To locate the sacrum, just simply put the palm of your hand at the beginning of your butt crack, basically. Or it can be done also with the two fists, by putting two fists at the sides of the sacrum and pressing firmly during the contraction. At one point during labor, you might feel that sacral pressure is not enough, or you don't like it anymore, and then you want to change into something different, and this can be done by the double hip squeeze instead. It might happen that you don't like sacral pressure also because baby has moved down, so actually by pressuring the sacrum you feel even worse because you are limiting the space of the baby. So double hip squeeze is great for example, the mid-labor or transition, because it really helps to widen the mid-pelvis or the outlet in this way. By putting the palm of the hand at the top of the iliac bone, and by squeezing towards inside, you're actually providing pain relief to the woman, and also helping to open this part of the pelvis. Now, the bones in the pelvis don't have a great mobility, but definitely this mobility is much more increased during pregnancy due to the hormones, such as the relaxin, that really helps the joints to move a little bit. So you can actually help a little bit to shape the pelvis to help baby to descend and to give relief to the mama in labor. The last counter pressure technique I'm going to explain you today is called the knee press. This simply consists in putting a firm pressure onto your knee while you are sitting. You can be sitting in the bed, in a chair, or my favorite is if you sit on the toilet. This is especially great during transition. If you don't know what a transition stage of labor is, make sure you check the video out. So if your birth support person places himself or herself in front of you and puts a double firm pressure on your knees during a contraction, then what you achieve is that the ligaments that supports the uterus in place, they get a little bit loose and they get a little bit of stretch so they can relax, and moms feels a lot of pressure from that. I'll explain you better. So the uterus is kept in the pelvis, yes, by the bone structure of the pelvis, but also by some ligaments, and those ligaments stretch as the uterus grows during pregnancy up to a point when they are really tight. So by squeezing on the knees, you actually give a little bit of bleed to those ligaments, and it might feel very good as sensation. That concludes my 3 way to go counter pressure techniques, but there is something else that I want your birth support to know how to do, especially when you're laboring at home or in early labor or at the beginning of your labor when baby needs to engage, and this is the lift and tuck. Consists in having your birth support leaning on a wall or nice and steady on the ground, supporting your weight. During a contraction, the birth support person places their hands at the bottom of your belly and gently lifts the belly and helps you to carry the weight of your uterus, which feels very good at the end of the pregnancy. At the same time, you tuck your sacrum in, so you have to have your knees bent, and while your birth support lift your tummy, then you can tuck your sacrum and your tailbone in. This really helps to widen the inlet of the pelvis and helps baby to engage. In fact, we know that the uterus grows upward in pregnancy, but also outward. So a baby that has a bit of trouble to engage might benefit from being lifted and kind of realigned with the axis of the mama's body. So definitely something to try in early labor. That's all for this video. The key message is to practice during pregnancy and also during labor before you decide what you like or what you don't like. Remember that you can ask your birth support to change the technique slightly, to place their hands a bit lower or higher, and to put less or more pressure according to what you need in that moment. If you've not done so already, make sure to subscribe to the channel, like the video, and I'll see you next time. Bye bye!